Good afternoon, everyone. My name is Haley McCullough from CDC's Office of Public Health Preparedness and Response, Division of Emergency Operations, and I'd like to welcome you to today's CERC webinar on messages and audiences. Today, we are joined by Kelly Waters, a Senior Health Communication Specialist. This webinar is participatory. To ask a question, click the Q&A button on your screen. We will get to the questions at the end of the webinar. If you have any comments, you can press your chat button and enter the dots there. You can receive continuing education credit for your participation. Please follow the instructions that were given to you in the invitation link. The access code for this course is CERC 0711. In all caps, that's CERC 0711. We'll go ahead and get into our presentation. We have Kelly Waters here, who is actually the lead of the CERC program. All right, Kelly, I'll go ahead and get your PowerPoint up and then we can begin.
Thanks, Haley, and good afternoon, everyone. Thank you for joining us. I'm going to go ahead and start this particular presentation with a brief overview of some of what we discussed before on the past two webinars. We talked a little bit about what CERC is. We did an introduction to CERC webinar a couple of months ago, and then we talked a little bit about why it's important when we did a webinar on the psychology of a crisis. And those get into a little bit of how to do CERC, which is today, messages and audiences. So I want to do a very brief recap. For those of you who already participated in those webinars, this will be a repeat. It'll be a little bit of a refresher for just a few minutes. For those of you who did not participate in those webinars, this will help give you some context for today's webinar, and also hopefully encourage you to participate in those webinars. They will be uploaded on our website, and you can participate on them after the fact. They're online, and you can still get continuing education credits for them there. So Haley, if you can go to the next slide. So the purpose of CERC, Crisis and Emergency Risk Communication Principles, they really help you make the best of a bad situation. We don't have enough emergency responders in any emergency, or really outside of an emergency, to help all the people who need help. In an emergency, more people obviously are going to need assistance. They're going to need information first and foremost. And they're going to need information about what they can be doing to help themselves, to help their family members, to help their communities keep themselves safe, and how to get themselves in a good situation to stay that way, to keep themselves protected. They're going to need that information quickly because time is going to be of the essence. We don't know in emergencies if the emergency is over, if there will be aftershocks, if there will be after waves of an emergency. So time is always going to be an issue. They're going to need that information quickly, and often those decisions, those options, the choices that they're going to have aren't going to be the ideal options. So the choices that they're going to have are going to be imperfect. CERC helps guide those recommendations that we give to the public. It helps guide us to make the best recommendations we can so that people can make the best choices that they can. Next slide. Ultimately, the right message, which is what we're going to talk about today, at the right time. Timing is so crucial. From the right person, and that's another webinar when we talk about the spokesperson. The right message at the right time from the right person can save lives. So we're going to talk, like I said, just for a few minutes, a really brief recap about what CERC is. Public health has to be all the time. Public health is 24 hours a day, 7 days a week. CDC staffed 24 hours a day, 7 days a week to protect people from threats, and they are global threats, they are domestic threats, they are intentional, they are unintentional, they are natural disasters, they are terrorism, they are all range of emergencies. And CERC applies in all of these situations. CERC was written in 2002, and although the manual has been through several iterations and has been through several revisions, the core of CERC has stayed the same. That said, it has become more of a framework. It's become more of a usable tool for communicators and public health responders to be able to pick up and use in an emergency. It's become something that hopefully in trainings like this and trainings, in-person trainings that we do and online trainings that we offer, that you can study ahead of time and be able to keep in mind when an emergency happens. We offer these resources so that you can be better prepared to have messages ready, to have communications plans in place when an emergency occurs, and be ready to tailor those approaches at the time of emergency and as an emergency evolves. CERC boils down to these 6 principles. Be first doesn't mean that you have to be the very first tweet or the very first iReporter. Being first in this land of social media and 24-hour news isn't what be first in CERC means. Be first in CERC means be first with information that is your agency's responsibility to share. So for an example, as CDC, when there is a public health crisis, such as H1N1, or a public health component to a crisis, such as the recent hurricanes that occurred in the Southeast United States and affected territories, including U.S. Virgin Islands and Puerto Rico, it is our responsibility to be first with public health messages. We wouldn't be the first ones to, say, share evacuation messages. That would be FEMA's job. So being first means to be first with the messages that your organization has the expertise and the professional subject matter experts to share. Be right means that you want to be as accurate as possible. Now, given an emergency, you don't always have all the information that you need. What you want to do is share what information you have, what you know, as soon as you have it. And as you get updates, share that information as soon as you get it. So it doesn't mean that you have to know everything right away. It's being quick to share the information that you do know. It's also being quick to correct information when you find out that you're wrong. So it's okay to be wrong. It's important to share the new information as soon as you find out that you have new information to share. That also gets to being credible. It's being truthful, it's being honest. You may have information based on the information you have at the time, you may share certain facts. Those facts may change based on information changing in the situation, but you can increase your credibility. You can be credible by correcting yourself, by sharing that correct information and sharing those updates quickly. Express empathy means expressing in words what people are likely feeling, identifying what the situation is likely reflecting in a community. So this is a scary time. Okay, this is an uncertain situation. Using those words demonstrates that you're really paying attention, that you're really engaged, and that you're really committed to being a part of the solution. Promoting action is what CERC comes down to. Again, there are never going to be enough emergency responders to one-on-one help all of the people in an emergency who are going to need our help. So what we want to do is communicate effectively, communicate clearly, and promote positive public health behaviors that help people stay safe, that help people stay healthy and well. Okay, this is where promote action comes into play. We need people to take these action steps so that we can promote positive public health. But it also helps to give people meaningful things to do rather than have them sit around and linger on the situation that they're going through. It doesn't change the stress of the situation, right? That they've experienced an emergency, that they've gone through a crisis. It doesn't make that stress go away, but at least it allows them to take some ownership of their situation back, to give them some ownership of their recovery. And show respect. Okay, show respect is something that shouldn't have to be part of our CERC principles. It shouldn't have to be stated, but it often goes by the wayside, understandably, in a crisis in communications, because from a responder perspective, having been through several emergencies myself, you're very, very focused on the task at hand. You're very, very focused on what needs to be done, right? And from a community perspective, from an individual perspective, from someone who's been through an emergency, you're very, very focused on myself, right? You're very focused on your family, your needs. And it's very hard to remember to focus on those around you and others. So it's crucial to remember when you're messaging that you want to be respectful. You want to remember to be respectful, okay? So be first, be right, be credible, express empathy, promote action is what all of this comes down to, and show respect. Those are the 6 CERC principles. And now we're going to talk a little bit about how we do this. Okay, we're going to get into messages and audiences. This is the CERC Rhythm, and there are a few steps to each emergency. Preparation is where you can start drafting your messages. So in the preparation stage, this is where you can start identifying who in your community you would be speaking to. Who are your audiences? Who are your primary languages? Who are your primary demographics? What are your primary education levels? What are your messages speaking to? How do they need to be tailored? This is where you can also start drafting some messages, maybe testing them out, so that when you get into an emergency, all you'll have to do really is start to tailor them to that specific situation. Preparation phase is huge in the CERC Rhythm. This is where a lot of the work can be done ahead of time, okay? The initial phase is when CERC actually happens, but if you haven't done any preparation, it's going to be really difficult to implement those CERC principles. The maintenance phase, for those of you who have already taken the Introduction to CERC webinar, is where you can start really tailoring your messages. It's where you can start providing more background information. As you get more context for an emergency, it's where the emergency starts to have a little bit of a rhythm to it, a little bit more of a pace to it. It's not those first initial hours. And that's where you can start providing a little bit more context for the situation. And the resolution phase is sort of self-explanatory. It's when you're starting to come to some sort of, resolution, and you can really start educating people on based on what's gone right and what's gone maybe not as well. You can start educating people on how maybe you can do things differently next time, how they can maybe tweak a crisis communication plan for a similar emergency in the future. Throughout this, you want to engage the community. Throughout this process, you want to keep evaluating your messages and your activities and your communication actions so that you can adjust them as needed. If they're not working, they need to be changed. And throughout this, you want to be empowering the community. to help you make these decisions. Because if they don't work for community members, then they don't work. Okay? So let's get into a little bit more example of how messages and audiences work. Okay, so the public is going to judge your message. They're going to judge your message by the content, which is what we're going to talk about today. They're going to judge it by the messenger, which is another webinar in and of itself. That's going to be the spokesperson. And they're going to judge it by the method of delivery, which again is another method, another webinar in and of itself. That's communications channels. Today we're going to talk about content. So you can better understand what your audience needs by understanding their relationship to the incident. Their psychological differences, which we talked about in the last webinar, the psychology of a crisis, which a brief overview basically means how people respond, how people react to an emergency. People react to emergencies in different ways. And it's important that as communicators, we understand, appreciate, and address how people are going to react to an emergency, because that's their response to an emergency affects how they may or may not accept our messages and take the actions we recommend. And demographic differences. We are going to talk about community engagement in the very next webinar, and a little bit about demographic differences. This is age, sex, languages, religion, cultural differences. We have to consider these things. So the audience relationship to the emergency. If you guys are familiar with a bullseye, you want to focus on those closest to the emergency. As communicators, we want to focus our messages on the people that are directly affected by the emergency. That does not mean we don't want to also communicate to the people outside of that immediate impact area. But this is how we prioritize our audiences. Okay, so if you look at the people close to the emergency, it's going to be the survivors of the emergency. The first responders, because by definition, first responders are first because they're in the community affected by the emergency, right? All emergencies begin and end at the local level. We always have to remember that. The public health community and the medical community are going to be our immediate audiences. And if you look at the italicized language just below that, emergency sunburst, you'll see action messages and safety messages. Those are the types of messages that audience needs, okay? And outside of that, you've got the public immediately outside. So a neighboring community, for example, the media, and then the families of those survivors and responders, okay? People who are just really interested in the messages. They don't need necessarily action steps, but they do need messages. They're concerned for safety. They need facts. They also may be wondering what if the situation spreads. So they do need information, okay? But not immediate action steps. Now, outside of that is maybe the international community, maybe businesses. What if they have locations? What if they have store locations in the area that's been affected? You know, communities that are wanting to express concern, elected officials from those affected regions that want to express concern, they're going to want to have information to follow what's going on, to express concern. They're also going to want to have information to perhaps do some vicarious rehearsal, maybe even some negative vicarious rehearsal. Next slide. Okay, so when we usually do this exercise, it's an in-person kind of exercise. But I'm including it in this webinar situation to demonstrate that when you're messaging, different audiences have so many different concerns. They have so much on their mind, okay? Survivors and their families, they might be concerned with personal safety, family safety, but they might also be concerned with loss of revenue and speed of information, right? Governments might be concerned with the speed of information, but loss of revenue. Local governments might be concerned with their personal safety and family safety. First responders are probably also, since we talked about all emergencies happen at the local level, personal safety, family safety, resources for response. Trade and industry is also going to be concerned with loss of revenue. But if it's a local business, again, they're going to be concerned with their family safety, their personal safety. Resources, again, maybe for response if they're wanting to help out their neighbors. Media, same thing, okay? They're going to be concerned about speed of information flow, guidance. But if they're local media, they're going to be concerned about their safety and their family safety as well. So all of these different audiences are going to have all kinds of things on their mind. And as communicators, for example, coming from CDC, if we want to come in and we want to share public health messaging in an emergency, we're going to have to remember that survivors and their families are also thinking about having worries about their own safety. They're going to be worried about their family safety. They're going to be worried about having just lost possessions, their livelihoods, maybe having lost their home. They're going to be worried about so many other things. They're also getting information from so many other sources. They're getting information from their neighbors, they're getting information from their employers, they're getting information from other family members and friends and neighbors, they're getting information from everywhere. So being inundated with information, having so many other things on their mind means that when we want to communicate something to them, we need to make sure that it's important, that it's necessary that we communicate it, that it's very, very, very short, clear, and understandable, okay? So when we go into a response, when we're trying to think of what do we want to say, what's important that we say, we need to ask ourselves what we would ask. What would we want to know in an emergency? You know, are we safe? What should we be looking out for? What will affect us? What do we do to get safe? How do we protect ourselves? Who caused this? Can it be fixed? This is not an all-inclusive list, obviously. This is kind of the things that we would want to know. And that's where you start. In that preparation phase, in that CERC rhythm that we showed you, that's where you start to kind of ask these questions when you're developing a communications, when you're developing a communications plan for emergencies. That's where you start to say, okay, if an emergency happens in our area, what are some things that people are going to need to know? So if hurricanes happen in our area, what are some things that people are going to ask themselves? If tornadoes happen in our area, so if you're really going to tailor that crisis communications plan, if you're going to make it an all hazards plan, if you're going to make it a general plan, you can still ask these questions. What are some things that people are going to want to know? And then try to answer them. When an emergency happens, then you can tailor them to that specific situation. And then when you get to writing those messages should be extremely short, okay? They should be relevant. Like I said, they should be super important to the situation, okay? When you get into a response, we talked about that maintenance phase. You can provide more background information. You can provide more context. But right when an emergency happens, those messages should be very, very relevant, okay? Hopefully just action steps. And they should be positive action steps. And what I mean by that is do this, not don't do that. And the reason we say that is because oftentimes the don't can get confusing. People won't remember whether they should do something or should don't something. So it's often clearer just to say do. Sometimes when you tell people don't, they follow up with, well, then what should I do, right? So just start with do. Also, there are a lot of people who have that inner 5-year-old that rebels against being told not to do something. So just go ahead and start with do this. Unless it's apparent that the only way and the clearest way to say something is don't. Okay, so for example, during Zika, we were advising pregnant women to avoid traveling to certain areas. The clearest way to say that was don't travel to these countries. Sometimes that's the clearest way, but more often than not, it's clearer just to tell people what they should do, okay? So for example, flu messaging is the best example of short, relevant, positive action steps. Cover your cough, wash your hands, stay home if you're sick. Very, very short, very, very relevant, positive action steps. It's very hard to replicate that in a lot of situations because we have very, very complex emergencies. We have very, very complex situations to communicate. So this is not always easy, but it's what we aim for. And then ideally, we also want our messages to be repeatable. We want them to be repeatable because free advertising, right? We want to share our messages and have people share them with their friends so that everybody hears them. But we also know that as messages are repeated, people are more likely to remember them, okay? The more they hear something, the more they are likely to recall those messages. So we've already talked about a couple of these and how to make facts work in your messages. We've already said give action steps and positives, make sure things are relevant. We haven't talked about a few and I'd like to focus on those. Use personal pronouns. We are here to resolve this issue. Instead of the CDC. It makes the response more of a community response, and you are working with the community. Like I said, the next webinar is going to be about community engagement, but you need the community to engage in developing your messages and implementing them. So using personal pronouns should not be difficult. We need to work together when developing communications in a crisis. Promise only what can be delivered instead of saying it's going to be okay. A lot of us have this tendency to want to say those things, but it's not something we can deliver on. We don't know that it's going to be okay, and define okay. Okay how it was before the crisis or new okay. It's not a statement that you can deliver on. So stick to those things that you can faithfully follow through on. We promise to provide updates at noon on every day. We promise to provide messages via your preferred Facebook account. Promise only what you can deliver. And if you can do more, great. Use plain language. Plain language is an entire course in and of itself, but the essence of plain language is use the language that people speak. Use the language that people use on an everyday basis. As a scientific organization, CDC knows a lot of big, complex words to discuss several of the complex infectious diseases. And sometimes we have to use those words. That's okay if you have to use those words, if you define them. If you have to use those words, just be sure that you define them. But if you don't have to use those words, if there's a more common term, use the more common term. It helps everyone understand what you're saying better. Avoid speculation. This is important. We don't want to guess what's going on. We need to share what we know to be true. Even if we think something is extremely likely, we should wait until we've confirmed it. Because if we're wrong, we run the risk of losing credibility. And then avoid humor. This used to say use humor with caution. We do not say that anymore. It's not funny. Some people use humor as a coping mechanism, and if people in the community do that, let them. But as an organization responding in an emergency, we really need to be respectful. This gets back to that 6th CERC principle, show respect. We really need to be respectful that not everyone's sense of humor is the same. Not everyone shares a gallows sense of humor, and we need to show that respect and remember that this is a crisis, it's an emergency. So 5 communications mistakes that we definitely want to avoid, okay? Mixed messages from multiple experts. This is not an easy one to avoid. We can't control what other organizations say, right? That said, what we can do is build relationships with our partner organizations and try to ensure that we are on the same page. When we are in that preparation phase, again, getting back to the CERC Rhythm that I showed you, we can plan who we will likely work with in an emergency, what our roles will be, and try to come to a consensus on who will message on what. And when we're in that emergency situation, try to make sure that we're working together to develop those messages and try to make sure that any discrepancies are resolved before we release messages. If you can't come to a consensus, it's really important that you stick to your messages and not point out other people's messages or discrepancies. It's really important that you just stay in your lane. Information released late. This gets back to the principle of be first. We just want to be as timely as we can with the information that we have. And we want to avoid paternalistic attitudes. Paternalistic attitudes means I know what is best for you to do with yourself. It's not just condescending. It's a grade above that. It's telling people that I know how you should live your life. And it's the least respectful thing that you can do to someone who's been affected by an emergency. So we definitely want to avoid that. Not countering rumors and myths in real time. We're going to get to that a little bit later, but really what we want to do when we see a rumor or a myth is determine whether it's harmful, whether it's encouraging harmful behavior, and we want to determine whether or not it's gaining traction, whether or not it's gaining a following. If those 2 things are true about that rumor or myth, then it's worth addressing in real time, okay? If it's got the potential to cause harm, and if people are potentially going to follow it. And public power struggles and confusion. Again, this is similar to mixed messages. If people look like they are not on the same page, if leaders in an emergency response look like they are not working together, people may not know who to follow. So we want to look like we're all working together. We don't just want to look like we're working together. We actually do want to be collaborating, working together. Ideally, successful communication comes from the combination of credibility and trust. It should be intuitive. The quicker we release the information, hopefully it's correct information, and as honest as we can be about that information. The combination of those two things should lead to successful communication. Now, that said, this is a science in and of itself because this is not always easy to do. Trust is based on doing what we say we're going to do. Okay, it's the result of promises fulfilled, which is why we talked about before doing what we say we can and not over-promising. Next slide. The consequences of over-promising and under-delivering are that people will not follow our recommendations. If people don't follow the public health recommendations that we offer in an emergency, if they ignore those recommendations, then injuries will increase, the rates of infectious disease will increase, and if the potential for death in that scenario is a possibility, then those rates will go up as well. Misallocation of resources may be demanded. What that looks like is people will be asking for medicines that they don't need. People will be asking for vaccinations. For example, during H1N1, priority was given to higher risk populations, meaning pregnant women, elderly populations, children, people with existing conditions such as asthma. I myself have asthma, so people who are at higher risk of severe reactions to H1N1 were given priority for a vaccine because there just wasn't enough vaccine to vaccinate everyone all at once. And because there wasn't enough vaccine, but a really high demand, there was a demand for everyone to have it. There wasn't enough understanding around why that priority was necessary. So there was demand for misallocation of resources. We just want it. Everybody wants it. So the communication plan had to be changed to explain the priority distribution. Public health policies can be circumvented. Opportunists prey on people. So if you ever see the messages saying we have the natural cure for Ebola, things like that. There is no natural cure for Ebola. And fiscal medical resources end up being wasted. So if people don't trust the organizations who have the right information, if people don't trust us to manage a response, they will go elsewhere looking for information and we can't do our job. That's what it basically boils down to. So how do we act trustworthy? We share information early. That is principle number one, be first. We acknowledge the concerns of others. That is principle number 4, express empathy. We already talked about under promise and over deliver. Select a spokesperson who is never condescending. That is something that we're going to talk about in another webinar. But again, it gets back to the right message at the right time from the right person can save lives. And we talked about engage third-party validators and advocates. This is getting basically an extra voice in there who can support you. So somebody else the community would trust. Say these guys are legitimate and they mean well and they have your best interest at heart. If it's the kind of community who maybe needs that extra boost of confidence. So that is the conclusion of the content of this webinar. These are some resources that we actually have on our CERC website. We have a lot of additional offerings for training. So we have online trainings. And like I said, we are posting the previous CERC webinars. We've done the introduction to CERC. We've done the psychology of a crisis, and this will also be posted on there, and you can continue to obtain continuing education credits if you take them after the fact. We also offer sponsored trainings, in-person trainings, if that's something your organizations are interested in. And we also have some resources, some tools that you guys can use. If you have questions, that is our CERC request at cdc.gov functional email box. Myself and my team members get emails to that box, so you can follow up with any additional questions. But we have some time. We have about 15 minutes that we can answer questions now. So if you have any, I'm happy to answer them.
Thank you so much for that wonderful presentation, Kelly. And we do have some questions. Can you explain vicarious rehearsal and provide examples?
Sure. Vicarious rehearsal is when you see something on the news and you say, oh gosh, what if that were to happen to me? So for example, I live in Georgia. We don't often deal with huge earthquakes. So if I see that and I say, what if that were to happen here, what would I do? And I start kind of thinking in my mind, and I start kind of thinking, would I prepare a kit? Would I hide in under a desk? Would I go into a doorway? And I start kind of mentally preparing. Now, negative vicarious rehearsal is acting on those thoughts in a detrimental way. So a good example of this is in 2011, during the Fukushima the nuclear reactors in Fukushima failed after an earthquake and a tsunami affected the facilities. And people in Fukushima were asked to evacuate the area. However, there were people on the west coast of the United States, in California and in Hawaii, that went to their doctor's offices and their emergency rooms looking for potassium iodide. They were looking for the medication that is supposed to treat radiation poisoning. They were overwhelming the healthcare systems. They were taking doctor's appointments from people who needed them, and they were taking medicine that they didn't need to take, which can be dangerous. Potassium iodide is actually dangerous if you don't have radiation poisoning to ingest, because they weren't aware that the radiation couldn't travel that far. So negative vicarious rehearsal can actually be dangerous if you take actions based on what would I do, and you don't need to do it. So I hope that's clear. Vicarious rehearsal is good. What would I do? Have a plan in place. Negative vicarious rehearsal is bad.
And just to clarify, Kelly, would a form of vicarious rehearsal be conducting drills?
A form of vicarious rehearsal could be, yes.
All right, thank you. We also have another question. So does CDC have guidance for preparing persons and communities before an emergency? What works to incentivize people to be resilient, to have knowledge or supplies before an incident occurs?
So do we have guidance to help people prepare in emergencies? Is that the question?
Right. So do you have guidance for forming preparedness messages, and what works to get people to adopt the actions portrayed in those preparedness messages?
Um, yes and yes and no. We have CERC, and we have some, like I said, on our tools in our CERC web resources and tools page. We have some how to get started writing your messages, and in our messages and audiences chapter. So it might be good for you to send an email, and I can show you exactly where they are to that functional mailbox. But the wallet cards that we have posted have exactly how to start writing those messages. And from there, it's really something you would have to tailor to the situation. So like CDC has an all hazards plan, but we also have some tailored plans. All organizations have their own plans. So we have, yes and no, we have ours, but you would have to tailor yours. It's a question that I can answer, and I can give you some samples. I don't have them in front of me right now, and unfortunately our internet's a little bit wonky today. So yes, I can show you the tools. Our wallet card is the best example, and it has some examples of how to start those drafts. Now, as far as how to get the best way to get people to engage, it's developing those community relationships and doing practice, somebody just wrote about our drills a good way, is running these exercises. We do it all the time internally as an agency, but we've been doing some with other agencies as well. We've been doing some with other public health departments. We've been doing some with other emergency response agencies. It would be a really good thing to do with local community organizations to get people engaged in what would we do as a community if this emergency were to happen. Do we all, pick an emergency if it's something that's likely to happen locally? I know, I was able to do a training in Hawaii, and they are extremely active in community engagement for emergency response. So it's something that you would do practice-wise, getting messages out, picking channels that people are really likely to listen to. So if it's a local Facebook page, if it's a local social media account of any kind, if it's a local radio channel that's really popular, if it's a local news channel that's really popular, if it's something that everyone's locally really engaged in, that's a great way to get the message out. It's knowing your audience and knowing what they're likely to see on a regular basis. Hopefully that's helpful. I can be a little more specific if I know a little more about your community. If that's helpful, definitely email that functional mailbox.
And just to add on to that, Catherine mentioned that FEMA has a Get Ready program that has a lot of information on this topic.
They do, yes.
All right, so our next question is, how would you suggest helping a public health department overcome a belief that public information, dispersal, or education is not a priority?
Oh, that's an ongoing question. It's a challenge that I've come up against several times. Even it's not just a local public health department, even at CDC, that action, logistics and operations and things like that always seem like they're the priority in an emergency. Interestingly, you spend quite a bit of time trying to communicate to the public with what they should do or what they need, or I think the best way to frame this is that we're never going to have enough responders one-on-one to help all the people that need to be helped. We really need the community to take action. We really need the community to work with us to be able to resolve emergencies. We really need them to understand what we're doing, and we really need them to share with us what they need from us so that we can address those gaps that we're not seeing. So communications is crucial, and the best way I think to go about that is to take our own advice and just keep repeating that. Just keep repeating it and repeating it and repeating it. To keep sharing this information, to keep encouraging these trainings, to keep sharing this type of content with decision makers, and to keep reminding them that we are never going to have enough staff to make people do what we're recommending in an emergency. The best way to resolve a crisis is to work together, and the best way to do that is to communicate.
Thank you, Kelly. We have another question, and this seems to be clarifying about the role of a spokesperson. Bill is asking, why not use the incident command structure available at every incident, no matter how small? That would mean there is one appointed spokesperson for every agency, responders, and no individual agency spokespersons.
Most responses are set up to use the incident command structure if they're familiar with it. Some organizations are not familiar with the incident command structure if it's a smaller response. That said, different agencies have different expertise, so sometimes you do need different spokespeople to collaborate, meaning this wouldn't be a small response, but when we were asked to come to Flint, Michigan to assist the government there with the response to the lead poisoning in the water crisis, FEMA had a different expertise than EPA, than CDC or HHS. So we all had a different expertise to bring to the table. So we all had a different individual able to contribute. And that's when you would have maybe a panel of people able to speak to the situation. There would be one lead in that situation for, say, a press conference who would be running the show, but it would be appropriate for each organization to have already identified who would be taking point for those questions for their organization. I'm hoping that answers your question.
Thank you. A few more questions. All right, Sarah says that I am a public health department worker in a very rural county, and I am also a PIO that is part of our overall county's crisis communications team. When we respond to an emergency, multiple agencies will be responding as part of a JIG. How do we still ensure we are first?
Okay, so where would the emergency be? I guess.
Haley, that's the first question?
Yeah. No. Haley, repeat the question for me, and then I'll do some hypotheticals instead of going back and forth.
Okay. All right. So this person is a PIO in a public health department in a very rural county, and they're part of the crisis communications team. So when they respond to an emergency, there will be multiple agencies responding as part of a JIG. So how do they ensure that they are first?
Okay. The way that our JIC works, the way that CDC's Joint Information Center works, if CDC is the lead organization on a response, then, so for H1N1 in 2009, CDC was the lead organization on that response. It was our responsibility to be the lead with public health messaging. For most other emergencies that we get invited to assist with, we are not the lead organization. We are there to provide technical assistance. So we provide that assistance. We help review messages, and we defer to the lead organization. So in your case, I would say it would depend on who is the lead organization, and that would I would guess would be determined by who's directly affected and what the emergency is. So if it's an environmental emergency, maybe your local environmental health organization. If it's public health, your local public health organization. So it would depend on a lot of factors, who would be the lead organization. And then that would be the organization that would be first to message. I'm hoping that makes sense.
Thanks, Kelly. One last question. If you're attempting to construct messages for immigrants or refugees, how would you go about that? Are there any resources to help a communicator do so?
Yeah, CDC developed CERC actually it was never developed for domestic responses. It was actually developed based on the author, Barbara Reynolds, based on her experiences with H5N1 in China. So it was developed based on an inspiration from an international incident. So these tools and these resources can be incorporated into any kind of communication with any kind of audience. Our community engagement chapter, we're going to do that webinar next week, but the chapter is already available online, and if you email that functional mailbox, I'm happy to discuss it with you in more detail. Should give you some more context for how to really engage with those communities. Again, I'm happy to talk to you about that. There are also some additional resources that have been tailored. So they've actually taken some CERC content and tailored them for international audiences. So our Center for Global Health and our CERC team collaborated with Coursera at it's if you look up Coursera, Couresa, and look up Communicating During Global Emergencies. It's a course that's available now. It was a collaboration with Emory University and the Center for Disease Control, and it's a course that's available on communicating during global health emergencies. So that could be a helpful resource. OpenWHO.org is also offering some crisis communication trainings tailored for international audiences. And then CDC's Global Health Group is also going to be posting a global risk communication training online in the next month or so. It's not done yet, but it also took principles from CERC and tailored them to working with global international audiences in low resource countries. So I would say the best way to work with these audiences is to access these resources and see how they've been tailored to communicating with international audiences. Again, though, I'm happy to discuss this in more detail if you want to send an email to that functional mailbox, and if you've got some specific questions that I can answer with more context.
Well, thank you, Kelly. We are right at time. And so I just want to thank you again for your presentation and thank everyone for participating today and all of your wonderful questions. Just as a reminder, you can receive continuing education units for participating. In order to receive those credits, you must follow the instructions found in your invitation and use the course access code that is in all caps, CERC 0711. If you have any additional CERC questions, you can email our functional box, which is circrequest@cdc.gov. Thank you again. Everyone have a good day.